Today, we're diving into 4 big troublemakers when it comes to eye health: keratitis, blepharitis, uveitis, and orbital cellulitis. These aren't just red eye annoyances. Each one can have serious consequences if not caught and treated early. Let's start with keratitis. Keratitis is inflammation of the cornea. It can be caused by bacteria, viruses, fungi, or even parasites. It might also come from physical or chemical trauma. Think contact lens overuse, corneal abrasions, or getting a splash of cleaning fluid where it doesn't belong. Symptoms? Pain, redness, tearing, sensitivity to light, and that awful feeling like something's stuck in your eye. If untreated, keratitis can cause scarring, ulceration, or even perforation of the cornea. Treatment depends on the cause: antimicrobial drops for infection, lubricants to protect the cornea, and sometimes even surgery if there's severe damage. The big takeaway? Keratitis isn't just an irritation. It can permanently affect vision. Next, blepharitis. Blepharitis is a chronic inflammation of the eyelid margins. It's often linked to skin conditions like seborrheic dermatitis or rosacea, or to bacterial overgrowth, usually staphylococcal species. Patients complain of burning, itching, and crusting along the lash line. The eyelids may be red, swollen, and greasy looking, and the lashes can fall out over time. Blepharitis can also cause recurrent styes or chalasia. Management focuses on good eyelid hygiene: warm compresses, gentle scrubbing with diluted baby shampoo, and sometimes topical antibiotics if infection is present. It's usually a long-term maintenance issue, not a quick fix. Now, uveitis. The uveal tract includes the iris, ciliary body, and choroid. Uveitis can affect one or more of these structures and comes in 2 main types: nongranulomatous and granulomatous. The nongranulomatous type is more common. It hits fast with pain, light sensitivity, redness around the cornea, and blurred vision. The pupil may look small or irregular, and in severe cases, inflammatory cells can settle in the front of the eye, sometimes forming a visible hypopyon. Granulomatous uveitis, on the other hand, creeps in more slowly, is often chronic, and may cause less pain but more severe vision loss. Either type can lead to complications like synechiae. That's when the iris sticks to the cornea or lens, blocking fluid flow and raising intraocular pressure. That can cause secondary glaucoma, and cataracts can also develop. Treatment often includes dark glasses for comfort, mydriatic drops like cyclopentolate or atropine to reduce spasm and prevent synechiae, and corticosteroid drops to control inflammation. If the problem keeps coming back, we dig deeper for causes: autoimmune disorders, infections like toxoplasmosis or TB, or even syphilis or Lyme disease. Finally, orbital cellulitis. This one's an emergency. It's an infection of the tissues around the eye, most often from sinus infections, especially the ethmoid sinus, but it can also come from skin infections, dental problems, or trauma. The most common culprits are staph and strep in adults. Symptoms include pain, swollen eyelids, conjunctival swelling, bulging of the eye, and trouble moving the eye. If the swelling compresses the optic nerve, vision loss can happen quickly. Because the orbit is so close to the brain, there's also a real risk of intracranial abscess or cavernous sinus thrombosis, both life-threatening. Management starts immediately with high-dose IV antibiotics, often before culture results are back. We monitor vision, eye position, and neurological signs closely. If there's an abscess or vision is getting worse, surgery to drain the infection may be needed, and ENT specialists usually get involved. Bottom line, eye inflammation and infection can go from uncomfortable to vision-threatening in no time. The key is early recognition, prompt treatment, and knowing the red flags that mean send this patient straight to the specialist.